Hello, everyone. Welcome to today's Kepro presentation. My name is Crystal Morse with Mountain Pacific Quality Health, and I will be helping and facilitating today's presentation on immediate advocacy, beneficiary complaints, hospital discharge, and skilled service termination appeals. Now, I'd like to introduce a key partner in the quality improvement work we all do. Shannon Shepard is an outreach specialist with Kepro, the Beneficiary and Family-Centered Care Quality Improvement Organization, or BFCC-QIO. She serves 10 states in the CMS regions 8 and 10. Shannon received her Bachelor of Arts in Communication from Metropolitan State University at Denver and her Master of Public Health in the University of Colorado. Shannon has worked in healthcare and nonprofits, improving health outcomes within communities through education, outreach, and health promotion. In her role as an outreach specialist, she collaborates with stakeholders and providers to help provide trainings and resources about Kepro services. With that being said, I'll hand it over to you, Shannon.
Okay, great. Thank you guys for joining today's presentation. And as Crystal mentioned, I'm Shannon, and I work for Kepro as an outreach specialist. I've been working for Kepro for the last 4.5 years, and I would be your point of contact if you guys have questions that come up in the field. My contact information is in this PowerPoint, which I will send out to Crystal, and she'll send that out to you guys after the webinar, so you guys will have that. But just so you guys know, I'd be your point of contact if anything comes up in the field. And so today I'm going to be just covering what Kepro services are. I'm just going to briefly go over them, but we'll also be covering information about the process for medical records, electronic submissions. We're also going to be talking about medical records documentation, and we're also going to be talking about filling out and delivering the notice of Medicare non-coverage. And so by providing these updates, I want to help you guys be more successful in your role, and also to inform you where to find resources as you might need them. So we will have a questions and answers at the end of the presentation. So feel free to type in any questions that you have in the chat box as they might come up during the presentation. But again, I will go over them at the end. Okay. And I want to first start before we start this presentation, I want to start off with a quote from Mark Twain. And Mark Twain said, "Continuous improvement is better than delayed perfection." And so today, let us work together on our continuous improvement in our roles as we serve Medicare beneficiaries. So Kepro is the Beneficiary Family-Centered Care Quality Improvement Organization for CMS's regions 1, 4, 6, 8, and 10. As you guys can see, all the areas that are colored there is the states that Kepro serves. And then Livanta is the other beneficiary family-centered care. And so the states that you see there that are whited out, those are the states that Livanta serves. And so the services are going to be the same regardless of where you are, whether if you're a beneficiary in California, in Wyoming, Colorado, the process will all be the same. And you would call into the respective helpline number. So in the state of Wyoming, you would call into that our toll-free number, as you can see there on your screen. So just as we have the beneficiary family-centered care, we also have quality improvement organizations on the QIN, which is where Crystal serves, and Mountain Pacific in the state of Wyoming. And together, we as quality improvement organizations, work to serve CMS's initiatives. Okay, so what services do Kepro provide for people with Medicare? We handle hospital discharge, skilled termination appeals. We have a service that's called immediate advocacy, and I will just kind of share what that is in a little bit later. And we also have, quality of care complaints. And just so you guys are aware, Kepro services are available for people with Medicare Advantage or Medicare as a secondary insurance. It just needs to be covered by Medicare in order for us to help them. So how do Medicare beneficiaries find out about Kepro and their appeal rights? Well, it depends on what type of setting that they're in. So if we look on the left side of the screen here, if they're in an acute care setting, they're going to get what's called an important message from Medicare, an IM. And that message is saying that you will be discharged and you have the right to appeal. And then in the state of Wyoming, you guys would have Kepro's, telephone number so that they could contact us. Now, with any type of appeals process, there are deadlines. And so in order for it to be a timely appeal, that beneficiary or their family member would have needed to call into our helpline by midnight the day that they're supposed to be discharged. Okay, so why is that important? Because if it's a timely appeal while Kepro is reviewing their case, they are financially protected. That means there's, they're not going to be responsible for any of the services while we're looking at this. However, if it's an untimely discharge, and if it doesn't come out in their favor, they have the potential to have financial liability. So if it is on time, then they'll be okay. We also issue HINS, hospital issue notice of non-coverage, and what that is saying is the hospital saying that this doesn't seem to be this place, and this potentially might not be covered. And again, they have the right to appeal. And again, it would just be the same process to call into our helpline. And hospitals can also request a review for us to look into cases as well. Now, if we go ahead and move over to the right-hand side of the screen, so let's talk about post-acute care, so outpatient rehab, home health, hospice, and skilled nursing facilities. So then the Medicare beneficiary or their family member is going to get the notice of Medicare non-coverage, or the NOMNIC. And then, so again, this is an appeals process. So they would need to, for a timely appeal, they would have to file noon the day before services are ending. Okay. Now, if it's an untimely appeal, they can certainly still call into us, but it's highly encouraged that they do that on time. Let's see. Okay, next. Okay, so we also handle beneficiary complaints, and so examples of quality of care would be wrong diagnosis, wrong treatment plan, poor discharge planning, things of that nature. We would need a medical record to review in order to find out if it's a quality of care. Things like poor bedside manner, things of that nature. Those kind of nuanced things would not be something that would fall under a formal quality of care complaint. Now, also with quality of care, care must have occurred within the last 3 years, and again, be covered by Medicare. And so we encourage you, the beneficiary, to complete the CMS complaint form, although they don't have to do that ahead of time. It's just encouraged. If they don't want to, then they can again call into our helpline, and one of our representatives can help them, fill that out. And so this complaint form must be filed by the beneficiary or their representative. And if Kepro does find anything in the quality of care, it would not be admissible in a lawsuit. Okay, and just so you guys are aware, some beneficiary complaints timeframes. So you guys have 14 calendar days to send in the medical record when a quality of care complaint is filed, so 14 days. And then so once we receive those medical records, we have 30 days to complete the review, and we will send out a letter to the provider and the beneficiary, and also let them know if they disagree with the outcome. Either the provider or the beneficiary can ask for a second level of appeal, which is a reconsideration. So the third service that I wanted to talk to you guys about today is called immediate advocacy. Now, this is an informal process used to resolve complaints or concerns. So this isn't anything that's, it's not going to have any medical records reviewed. We're just, trying to help with some of these nuanced issues that come in with healthcare transitions, so kind of think about immediate advocacy in terms of, say, for example, a Medicare beneficiary is really frustrated. They didn't win their appeal from Kepro, and they still don't feel they're ready to be discharged, and they're really unhappy. You guys can certainly have them call in and speak to one of our immediate advocacy nurses, and we will go through and explain to them why they didn't win their appeal. And then if they have any, concerns, such as like maybe they're not sure about their wheelchair or other durable medical equipment when that might be coming. Perhaps they have some questions that just weren't answered, or, any, care transition type issues, then this would be a really great place for you guys to refer them into our immediate advocacy services. And all they have to do again is just call into our helpline. Okay, so now we're going to change gears here and talk about the new process for submitting medical records. So as effective October 1st, CMS requires that all providers to send requested patient records to Kepro electronically via the BFCC-QIO approved method. Now, CMS understands that some facilities may not have the capacity yet to send in medical records electronically, and that's fine. However, there will be a process, which is you will need to get a signed and approved waiver, and I'll show you guys after this where to find that on our website. But so there's a waiver, you'll fill it out, you'll send that in, and that will be approved, and then you can receive reimbursements. And so provider reimbursements for the electronic format will be $3 for complete patient records. And if you send it either fax or mail, again, with that approved waiver, it'll be 15 cents per page. Okay. Okay, so now depending on the two different types of medical records, so whether it's for an appeals or quality of care, there's going to be two different sets of processes. So we will send you, if it's for discharge appeals, we're going to fax that, medical request to you guys, and then you guys will go onto our website to our portal, and you can see here's the hyperlink, and then you will submit the medical records electronically through Kepro's portal. However, if it's a quality of care, then we will actually email you guys, and then we will request that, and then we will, once we have the confirmation that from your email that you have that, then we will go ahead and send you a link to the CMS submission portal. Okay. Oops, let me go back. Oops, I'm sorry about that. And then do we want to do the polling questions, Malin? Yeah, perfect. And then you guys, can you guys just really quick, just want to go through and just do a few polling questions here? Should I stop the share? Okay, let's see. I say a message that says host and panelists cannot vote.
Are the participants able to vote?
I'm getting a message that says host and panelists cannot vote. Okay. Can the participants?
Yes, they are voting.
Okay, perfect.
Thanks, Maynette.
Okay, great.
I can show you the results of that one right now.
Yep, perfect. Okay, perfect. Let's see. Okay, let me see. Okay, number one, that's great. Okay, so number one, where do providers electronically send medical records for appeals? Again, it's going to be correct. That's Kepro website. Number two, where do providers electronically send medical records for quality of care complaints? So that will be was it through MFT? I think it's B. I'll just check that one. What do providers need to do if they cannot send medical records electronically? Yes, so the answer would be C. You guys will fill out a waiver and submit the waiver to Kepro. Okay.
Oh, wait, we don't have those ones up yet.
Oh, okay, really?
Yep. So are you ready for the next polling series?
No, that should be on the one, right? Okay, pull that back up. Let's see. Yeah, no, the third one, that's right. So you guys, the third one, where do you guys send the medical records? Yep. So that it's going to be, you're going to fill out the waiver and submit the waiver to Kepro. So that's correct. Good job, guys. Okay, so not the polling questions yet.
Okay.
Okay, great. All right, now what we're going to do is I'm going to oh, okay, so not the polling questions yet. Let's hold off on that. I'm going to go over the next section and then we'll do the polling questions after that. Okay, so now we're going to go, I'm going to, let's see, share my screen here. Okay, can you guys see the Kepro's website?
We can see the service areas.
Okay, perfect. Awesome. So you guys, this is the Kepro. This is our homepage. So I just want to kind of go over a few things here. So we also have a case status check feature. So if you guys need to want to know updates about where the status of the case is, that's right there. That's also available for the beneficiary or their family members. And with our case status check feature, it'll also let beneficiaries know, if they have any financial liability, when that would begin. We also have a link here for the memorandum of agreement. That's an annual thing that you guys have to submit to Kepro. So just make sure you have that updated. Now, since we will be contacting you via email to, request the, so you guys can send in those medical records, you guys want to make sure that we have your updated contact information, because we're going to email whoever you put down for us to contact for the quality of care complaints. So if you're not sure, perhaps there's been staff turnover, that's totally fine. See, as you can see here, you'll just go ahead and select update your provider contact information, and then you'll just scroll down and then you'll see the online provider update form, and that will just go ahead and take you into our portal, and then you can kind of update that contact information from there. Okay. And I would definitely recommend you guys, so Kepro is not going to reach out to you guys and ask if you guys have updated this. This is just something that you guys are just going to have to stay proactively on top of, and to go ahead and just update your contact information. Okay. Now, let's say, for example, you have other questions about the medical records submission, or you need to get to our portal. You can see right there, it will take you to this page. And then, so for the appeals, you will go here, you will select this, okay, appeal submission, and that will take you to our portal for that, okay? Now, we also have, just kind of, we also have the waiver form right here. So for you guys that aren't yet capable for sending it electronically, here's the waiver form. You'll click on that link, you'll fill that out, and then you can go ahead and email that back. Okay, and then we do just have some FAQs here about submission, reimbursements, and waivers. So feel free, you guys, if you have that, to read through that. It does kind of give a good overview for any of those questions. Okay. Okay. All right, so now we're gonna change gears here. Okay, so now we're gonna have go over 2 videos. So one is just about documenting medical records, and so this is just an informational video that we've produced for you guys, just to kind of help give you some tips, and also just again some guidelines and tips for issuing the notice of Medicare non-coverage. So I will go ahead and play those 2. Let's see, make sure I gotta make sure to do my, hang on a second here. I gotta share my audio here. Boom, 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 share screen. Okay. Okay. All right. Okay.
Kepro is the Beneficiary and Family-Centered Care Quality Improvement Organization, also referred to as the BFCC-QIO for 29 states. One of the responsibilities of the Medicare BFCC-QIO is to perform hospital discharge and skilled service termination appeals for Medicare beneficiaries who feel their care is ending too soon. Appeals affect a variety of Medicare providers, including hospitals, acute rehabilitation facilities, long-term acute care hospitals, critical access hospitals, skilled nursing facilities, home health agencies, hospices, and outpatient rehabilitation facilities. The appeals process can be confusing to healthcare providers, and Kepro hopes to provide information to its healthcare partners in order to reduce any confusion. Kepro has identified that there are educational opportunities for providers based on tracking and trending of appeal data from June 8, 2019 through April 30, 2020. Data analysts have noted several states with a high volume of appeal review denials. An appeal review denial means that Kepro does not agree with intent of the notice, and the submitted documentation did not support the decision to discharge the Medicare beneficiary or discontinue his or her skilled services. This video will provide you with tips about documentation requirements to help ensure that medical records are complete and contain the appropriate level of documentation to help ensure the appropriate appeal outcome. The medical record submitted to Kepro needs to contain the specific components requested. It should be detailed and provide a clinical picture of the beneficiary and his or her healthcare needs and progress, and it should be consistent among the various healthcare disciplines, such as the attending physician, nursing, and physical, occupational, and speech therapies. An example of inconsistent documentation would be if a physician documents within the medical record that the patient is walking 150 feet with minimal help. There should not be physical therapy notes in that same record stating that the patient is walking 25 feet with maximum support. Other common documentation problems in the medical records that cause the physician reviewer to find in favor of the patient include insufficient documentation of therapy and other skilled services, which would include a lack of physical therapy, occupational therapy, or speech therapy evaluation and subsequent progress notes. A lack of social services or case management notes, including the discharge summary, orders, follow-up consultations, and follow-up care. If there is unclear or no documentation of follow-up with the family or caregiver about patient education for care, such as, has the patient family been taught how to provide care for his or her specific health need? Is that education documented within the submitted medical record? If there are significant medication or lab changes with no follow-up documentation. Some examples include, is there documentation that an abnormal lab value was called to the physician? If a beneficiary recently started on insulin, is there documentation of blood glucose monitoring? If yes, were there any abnormal values? And if yes to that, were these addressed? As part of Kepro's internal quality program, medical directors oversee the physician reviewer's case review decisions to ensure Their best clinical judgment is used in rendering a decision, and where it is appropriate, coverage guidelines from the Centers for Medicare and Medicaid Services are followed. For more information about the volume of reviews and the rate in which a Medicare provider's appeals are overturned, Kepro's annual reports are available at www.keproqio.com About Us. That is www.keproqio.com/About Us. If you have questions,
Okay, I'm just going to stop it there. And if you guys wanted the our annual report, I can also send that out with a PowerPoint presentation. So just kind of, if you want to just throw that in the chat box, if you guys want me to send that to Crystal as well, I'd be happy to do that. Okay, so now we're going to also go over the notice of Medicare non-coverage. You know, this might be just a reminder. Perhaps, hopefully, you guys can get a few helpful tips from that. And then just so you guys are aware, if you guys wanted to access these videos, if you just go into YouTube and then just type in BFCC-QIO, and then underneath here are our videos. So we're gonna move on to the notice of Medicare non-coverage.
Kepro is the Beneficiary and Family-Centered Care Quality Improvement Organization, also referred to as the BFCC-QIO for 29 states. One of the responsibilities of the BFCC-QIO is to perform hospital discharge and skilled service termination appeals for Medicare beneficiaries who feel their care is ending too soon. This video will review the Notice of Medicare Non-Coverage form from the Centers for Medicare and Medicaid Services. This form is commonly referred to as a NOMNIC and is used for skilled service termination appeals. Let's go over how the form must be delivered and how to fill it out. A Medicare provider or health plan must give a completed copy of the NOMNIC to Medicare beneficiaries who are receiving covered skills services. The NOMNIC must be given when the last skills service is to be discontinued. The NOMNIC must be delivered at least 2 calendar days before Medicare covered services end, which is known as the effective date, or the second to the last day of service if care is not being provided daily. For example, the notice may be given at 3 p.m. on a Wednesday, with the effective date being Friday at noon. The NOMNIC must be signed and dated by the Medicare beneficiary, which indicates receipt of the notice, not agreement. The notice is required even if the beneficiary agrees that services should end. If the beneficiary is not competent to make decisions, then the notice must be delivered to a representative. Typically, a representative would be someone who has legal responsibility to make decisions such as consent to treatment. Providers are required to have a process in place when the beneficiary is not competent and is not able to get the representative's signature in person. The provider should call the representative on the phone to advise when the services will no longer be covered. The date of this call is the delivery date of the notice and must be 2 calendar days prior to the effective date. The information provided should include the beneficiary's last day of covered services and the date financial liability is expected to begin, the right to appeal a coverage termination decision and how to do that, including the telephone number for the BFCC-QIO, the deadline to request a review, and what to do if that deadline is missed. This information should be noted in the additional information section found on page 2 of the NOMNIC. It is the healthcare provider's responsibility to show that they made proper verbal or telephone notification. Providers must mail a copy of the completed NOMNIC to the representative on the same day as the phone call. If the representative can't be reached by phone, the notice should be sent by certified mail with return receipt requested. The date the representative signs or refuses to sign the return receipt is the date of NOMNIC delivery. When the notice is returned by the post office with no indication of refusal, liability starts on the second day after the provider's mailing date. Providers must place a dated copy of the notice in the beneficiary's medical file. Now let's go step by step through the form and look at how it should be completed. The Office of Management and Budget requires the NOMNIC to be two sides of one page or one side of two separate pages. If it extends beyond 2 pages, it could become an invalid notice. Any entries on the form must be legible 12-point font, including handwritten entries. The provider's name, address, and telephone number must appear above the title of the form. You may use your organization's logo. When adding this information, be sure that text does not shift from page 1 to page 2. Providers must fill in the beneficiary's name and an identification number for the member number. The health insurance claim number, also known as the Medicare number, cannot be used. Insert the effective date, which is the date the services will end, and service type in the first sentence. In Bullet 4, insert the name and telephone number, including the TTY, of Kepro, which may be found at www.keproqio.com. If you are a health plan, the plan's name and contact information must be displayed here in the event the beneficiary or Kepro needs this information. In the additional information area, the provider may include pertinent information that may be useful to the beneficiary. This area may not be used to take the place of the detailed explanation of non-coverage. If the Medicare beneficiary refuses to sign the document, refusal should be noted in this section and in the medical record. The beneficiary or representative must sign and fill in the date that the document is signed. It is important to complete the NOMNIC correctly so it does not have to be reissued. If the NOMNIC is determined to be invalid, Kepro will disagree with the discharge and the process will begin again. Here are some common issues that make the NOMNIC invalid. The name of the Medicare beneficiary is not in the designated area on the form. There is no Office of Management and Budget approval number or Centers for Medicare and Medicaid Services form number. An expired notice is used. The form is not signed and there is no documentation of verbal or telephone notification on the NOMNIC or within the medical record. The signature cannot be read and there is no documentation in the medical record about the delivery of the notice. Documentation of the verbal or telephone notice is lacking. The notice was not delivered within the required time frame. The future effective date is greater than 3 days. To download the NOMNIC or for more information on how to complete it, visit the Beneficiary Notices Initiative website at www.cms.gov/BNI. If you have
Okay, great. All right, let's stop that. And then do we go ahead and do those polling questions? Very good. Everybody got 100% on that. Yes, there does need to be consistent medical documentation between the disciplines about the patient conditions as the video covered. And so these videos really came about because there were certain trends, and so these specific issues were continuing to come up. So good job. Okay, then how about the next polling question? Oh, okay. So we definitely have split on this. So number one, is the NOMNIC issued when the last skilled service is discontinued? Yes, it is. Okay. So when all of them are going to be discontinued, that is when you would issue the notice of Medicare non-coverage. And then can the NOMNIC be issued 48 hours in advance? Oh, it's 2 days. Okay. So it's 2 days. Okay. Good job, guys. All right, so let's go back to the PowerPoint. And then can you guys see my PowerPoint?
Yes.
Okay, perfect. Let's get this back. Okay, great. Now, just to go over Kepro hours so you guys know, so weekdays we are open 9 to 5, and that's all local time zones. So we're all in Mountain Pacific time, so we would be open in our time zone. And say, for example, if we're in Central time zone or Eastern time zone, wherever that may be, will always be open during that time per your time zone. Weekends is going to be 11 to 3, as well as holidays. Voicemails can be left during any other hours. We do have translation services available. And then just so you guys know, voicemails will be the time date stamp of an appeal. So that's okay. If a beneficiary or their family member calls after hours, that's fine. You know, if it's 8 p.m. on a Friday, then we know that's 8 p.m. That'll be the time date stamp of their appeal. So collaboration with outreach specialists, you know, definitely keep me in mind. You know, if you have other presentations like I do with Crystal, or if you guys are having any quarterly staff trainings, you know, I'd be happy to join, or I can schedule a webinar with you guys directly. If you have any advisory boards or things like that, definitely keep me in mind. So today we covered hospital discharge, skilled service termination appeals, beneficiary complaints, immediate advocacy. We also went over some recent updates with the electronic medical record submission, and we talked a little bit about medical documentation and also issuing the notice of Medicare non-coverage. If you guys want to sign up for our email list to receive updates or for a quarterly newsletter, there's that link there. And again, I showed you guys how to get to our YouTube videos. And again, you can always go on our website, www.keproqio.com. And so we also have all of our contact information, and so in all the different regions, as well as our mailing address and fax. And now we're going to just go ahead and open it up for Q&A.
Shannon, there are a couple of questions in chat to start with. So from Kara, she asks, and kind of to go back to when you were screen sharing, navigating the website, it says, how do we know our current contact information is? So can they go on there and look in the website?
No.
Okay.
No. Good question though. No, and that's why I said it's probably a good idea that you guys go, because so here's all the context that we need. Okay, so we're going to have The person to contact for discharge appeals, just normal Monday through Friday, normal business hours. Then we're going to have them, you know, after business hours, Monday through Friday, weekends and holidays. Then we'll also have a point of contact for quality of care complaints. And then previously in the last scope of work, we also needed contacts for short stay reviews. Right now that hasn't been issued, so we don't need that information currently. But so that's kind of a whole host of different people. And the ones that I hear about the most are on the weekends. So the person that normally handles the discharge appeals will come back on a Monday and say, hey, I didn't get this email. And now, you know, we're running behind on getting this information to you. So I would say, make sure you have the right person on that weekend. Now, if you also want to be included in on that, so say, you know, you're the director and, you know, you're not necessarily answering that, but say Shirley is, and then you can also put 2 names down. So you guys can designate as many people as you need, but just again, make sure that you have those after hours and weekend people. Okay. And you can put that all on the form.
And then Anne is asking about the NOMNIC. So the last 2 polling questions, she's asking that the NOMNIC is issued when the last skilled service is scheduled to end, not after it ends or on the day it ends. So I guess questions about clarifying of the 48-hour the issue noticed.
So yeah, so when like the in the video gave an example, right? So say the effective date is on the Friday, then you could issue it 2 days before. So all those services are going to be ending by that effective date. Does that make sense? And so you want to go 2 days prior to that.
Does that answer your question, Anne? Oh, I'm okay. She says I'm recommending that you reword the questions for the poll. Okay.
Okay. Thank you for that feedback.
Yeah.
Mhm.
What's the earliest you can issue it?
2 days.
Okay, so that's the earliest. You can't
Yeah.
go any
can't-
earlier.
No,
Okay.
you can't, you know, because then otherwise then you'll get that you'll have to reissue it. So you have to do that. It's a little bit different in the hospital settings, but for the NOMNIC, you have to do that the 2 days prior to that effective date. So we were seeing, you know, that being a little confusing. So just so you guys are aware, so it's 2 days prior to the effective date.
Let's see. Here's another question. Have you seen a change in volume, an increase or a decrease in appeals and or complaints since COVID?
You know, initially we definitely saw, you know, a decrease, right? So as, you know, services were a little, you know, like elective surgeries and, you know, things of that nature were, you know, limited, we definitely saw a decrease. And then sort of as the restrictions per states, you know, we're kind of seeing things sort of quote unquote go back to normal. Yeah. But I think, yes, I mean, I think invariably these COVID, you know, so it's definitely going to impact things, I think, you know, and we'll see a little bit, you know, more substantially over time. So not this next year's annual report, but the following one will really show us, like, you know, what the difference is.
How about Shannon, is there somewhere on your website or somewhere where you can refer us to as far as scripting for delivering the message? I've heard it delivered several different ways, and I don't know if there's a wrong way or a right way, but is there anything out there that you could refer us to?
You know, that's a really great question, and that's come up a couple times. would you mind actually emailing me that directly, and then I could take that to, the right person within my organization that could, better answer that question for you. But right now, no, we don't technically have, any, per se scripting for you guys. But, be happy to kind of figure out, how to work with that to make sure you guys have that information. Definitely.
Okay. Then I can share that. If you find anything out, I'll be able to share that with the group here.
Yeah, that's perfect. Yep.
Okay, I don't see any other questions in the chat. Does anyone have any other questions? To unmute yourself, or feel free to put it in the chat, but I don't see anything other.
Another question in the Q&A.
Okay. Thank you, Minette. So does Kepro ever call the facility if there is no response to an email, perhaps due to not having updated contact information? That's
Yes. Yeah. Yes, we will try to call and email. We'll try several methods. And again, that'll be what you guys have given us. So we definitely, obviously we don't want to, have to issue technical denials, right? Like that's not our goal. Our goal is we do want to get these medical records, and we're not assuming that you guys are, not holding them back. It's just sometimes these, communication gaps occur because we just didn't have those updated contact information, but we're definitely going to try to get a hold of you guys and make several attempts.
Any other last thoughts for Shannon? She is your representative for Alaska, Montana, and Wyoming, correct, Shannon?
Correct.
Okay. Can you confirm that the NOMNIC can be given 3 days ahead?
No, it cannot. 2 days. 2 days only. You can't give it earlier than that.
So if it's dated earlier than that, will it be
denied, and then you're going to have to reissue it and then start the whole process over again.
Is that what you were asking, Anne? Is that clear?
And did anyone else have anything, in terms of the notice of Medicare non-coverage, besides sort of scripting or anything like that, that you also wanted me to take back to, my subject matter expert on that topic? Now that we're here and I have you guys captured here, I definitely want to make sure to support you guys, and you guys have those resources and information. So, I'm here to help. Okay, speak now, forever hold your peace.
And Anne's provided a nice link in the chat. I
Okay.
encourage you to check it out. Okay. Well, if no other questions, I think we'll end there. And Shannon, great presentation, and I appreciate you. And again, invite her to, as she said, she's willing to come and talk to your organizations on how to help out your staff there. So give her a holler, and we'll send out the recording and the slides for you all. Thanks for joining, everyone.
Thanks, guys. Thanks for joining today.